In this video, I'm going to talk about the biggest mistake that doctors make with patients and how you can avoid them. Most doctors don't realize that they're making these mistakes until it's too late. The worst part costs them their patient's trust, potentially their reputation, their peace of mind, and puts them at risk for burnout. If you're a doctor, you need to hear this, because once you do, you'll approach patient care differently and you'll be happier in your job. By the end of this video, you'll know the 3 biggest mistakes that doctors make with their patients. Mistakes that potentially damage physician-patient relationships, can hinder outcomes, and create unnecessary stress. But more importantly, you'll learn exactly how to fix them. And here's the kicker. These mistakes aren't just clinical errors. They're communication breakdowns, mindset traps that we learn during our training, and subtle behaviors that can push patients away without you even realizing it. I want you to imagine for a second that you walk into an exam room and you instantly make your patient feel at ease. Imagine patients trusting your advice, following your recommendations, and coming back because they felt heard and engaged in their care, even recommending you to their family and friends because you're just that kind of doctor that everyone needs to see. Picture yourself finishing your day feeling fulfilled, knowing that you truly connected with your patients, that you partnered with them in your care. Not only did you treat their symptoms, but you built a real relationship. Hi, I'm Dr. Ben. I'm a pediatric cardiologist with over 20 years of experience in academic medicine. I'm also a physician coach, and I've spent years not only treating patients, but I've also honed my communication skills, and I've coached other doctors on how to improve their approach so that they can avoid these mistakes and find joy in their medicine and their medical career. Let me tell you, I have been there and I've learned from my mistakes. I've also watched other doctors make the same mistakes. I've seen brilliant doctors struggle, not because they lack medical knowledge, but because they unknowingly lack the skills that they need to connect with their patients and then end up pushing them away. That's why I'm here, to help you change that pattern. So here are the mistakes that I see physicians make. Mistake number 1, treating the condition, not the patient. We went into medicine because we like the subject matter, but we also wanted to connect. And here's the harsh truth. If your patient feels like a diagnosis or a checklist instead of a person, you've already lost them. Doctors are trained to diagnose and treat, but in that process, it's easy to forget that you're also dealing with a person, with a human being, not just an interesting medical case. Have you ever had a patient nod along, giving them nonverbal clues that they're following you, but then they never follow through with their treatment plan? That may be because they didn't feel seen, that they felt like a diagnosis, not a person. So here's how you can fix that. Before jumping into the plan or symptoms, take 30 seconds to connect. Ask them about their day. Look them in their eye. Make it clear that you care about them, not just their chart or their diagnosis. Repeat their concerns back using phrases like, "So what I hear you saying is," this small act makes them feel heard and validated. Mistake number 2 is over-explaining and using way too much medical jargon. You might think that explaining every detail of a condition makes you sound smart or it makes you a better doctor, but to the patient, it can be overwhelming and it's just noise. I see doctors do this all the time. Instead, it creates confusion and anxiety. A confused patient is a non-compliant patient and is an unhappy patient. So here's how you can fix this issue. Ditch the medical jargon. For example, instead of saying, "Your ejection fraction is low," you can say something like, "Your heart isn't pumping as strongly as it should be, and here's what we're going to do about it." You can also use analogies. So think of your arteries like pipes. When they get clogged, blood doesn't flow, just like water doesn't flow through a clogged pipe. That's what's happening here. And finally, ask clarifying questions. Does that make sense? Or what can I explain differently? Or how can I help? Give them permission to ask questions instead of just nodding along and being a bystander in their own care. Mistake number 3 is rushing through appointments. I get it, and I know appointments are back to back. We have a limited amount of time, charts are piling up, and you can't just slow down. But there are things you can do that can avoid the patient recognizing or feeling like you're rushing through their appointment. And when patients feel rushed, they feel unimportant, and that's when trust erodes. The irony, slowing down for just 1 extra minute can actually save you time, because a patient who feels heard is less likely to come back with some unresolved concerns or is less likely to message you in off hours for clarification. So here's how you can fix that feeling of rush. At the start of every appointment, take a deep breath. Center yourself before you even walk in the door. End the appointment with this question. Is there anything else on your mind? Patients often save their real concerns for last. And if you don't have time to address it, say, "Let's schedule a follow-up visit to address that concern. I'm sorry, we don't have time today." Finally, use open body language. Sit down instead of standing. Uncross your arms. Show them that you have their full attention. So let's recap the 3 biggest mistakes that doctors make with their patient. Number 1, it's treating the condition, not the patient. Number 2, it's over-explaining and using medical jargon. And number 3 is rushing through the appointments. If you can fix these, you'll have better patient outcomes and you'll have a more fulfilling career. Because at the end of the day, medicine isn't about knowledge. It's about people and it's about connection. So here's my challenge to you. In your next patient interaction, slow down, make eye contact, listen just a little longer, ask them about their day, and see the difference it makes. If this resonated with you, hit that like button and share this video with others. Also subscribe for more content on becoming a better, more fulfilled doctor, because development never stops.